How's this for brain power? Tech billionaire Elon Musk says his Neuralink company has successfully implanted a wireless chip into a human. The US Food and Drug Administration gave the company clearance last year to conduct its first human brain trial. The company says the study will assess the functionality of people with quadriplegia or paralysis of limbs to control devices with their thoughts. Well, Anil, Seth is Professor of Cognitive and Computational Neuroscience at the University of Sussex. Thanks for coming on Global Business Europe. Now, how would you say that Neuralink works?
Neuralink is an example of this technology. It's actually been around for a while, of brain implantation. And basically, it's kind of simple, really. I mean, not much about the brain is simple, but the technology at heart is. It involves just implanting very, very thin wires into the brain so that they can record activity from inside the brain and also stimulate activity inside the brain. And you connect these wires then to some kind of chip which can decode signals and figure out how to do the stimulation. That's why it's called a brain-computer interface. It really does directly interface the brain with a computer.
Is it safe? I mean, is it something that you'd volunteer to have?
Well, at the moment, it's something that's done for clinical need. So I wouldn't personally volunteer to have something like that done. But it has been around for a while. I mean, I think there's this, heard this sort of idea that this is the first time this has happened. It's not the first time this has happened. Brain implant technology has been really developed since the mid-20th century, and certainly in the last 30 years, there's been quite a track record. So it's not unsafe. It is invasive, which is to say it does involve sticking something into the brain. So that's always going to carry some risk.
But Elon Musk said that it will enable control of any device through just thinking, and he hopes it's going to help people with disabilities. Do you see this maybe catching on amongst able-bodied people who just want a bit of an edge and are going to use this technology to give them that edge?
I think that's a fascinating question. Of course, it has many ethical implications as well for how we deal with these new technologies in society. There are really two very broad applications. So most of the brain implantation work that's been done so far has been for specific medical conditions. So, for instance, people with paralysis might be able to regain some control of their limbs if their movement intentions, what they want to do, can be read out from their brain to stimulate their muscles. Similarly, people who've maybe lost vision or lost their hearing could regain these senses in some way if the brain can be stimulated by output from a camera, something like that. And there are other applications for Parkinson's disease, for depression, that have been around for quite a long time. But I think one of the reasons why people get excited about Neuralink, and because it's an Elon Musk company, is the possibility of some wider uptake. That once you can record from the brain, maybe decode what people are thinking, what people are feeling, what people are experiencing, well, that really is what we call a dual-use technology. There are many potential benefits from doing that, but there are also many potential worries. Yeah. I don't think we'll see it catching on too widely, mainly because implanting things in the living brain is something that I expect will remain very tightly regulated, and for good reason.
It's mind-blowing, isn't it? Anil, Seth, pleasure talking to you. Thank you very much.
Thank you.